Hospitals are supposed to be centers of healing, places where brilliant, highly trained professionals save lives every single day. And they do. But hidden behind every gleaming corridor and sterile waiting room is a world of bureaucratic absurdity that would make your head spin. And we're talking rules so baffling, so disconnected from reality, that the very doctors and nurses tasked with following them couldn't believe they were real. Rules written by people who had clearly never set foot on an actual hospital floor. Rules that wasted time, confused patients, frustrated staff, and in some cases nearly cost lives. Today, we're counting down the 50 dumbest hospital rules that real doctors and nurses had to follow. These come from medical professionals across the country, anonymous, exhausted, and very much done pretending these policies made sense. Buckle up, this is going to be a wild ride through the best of hospital bureaucracy. And if you're new here, hit that subscribe button. We do deep dives like this every week. Rules 50 through 41. We had to start somewhere. Rule number 50. No running. Ever. Under any circumstance. Sounds reasonable, right? Except this rule was enforced even during cardiac codes. Nurses reported being written up for jogging 6 feet down a hallway to grab a crash cart. Administration's response? Walk briskly. Yes, walk briskly. To the dying patient? Briskly. Rule number 49. Doctors must always wear a white coat, even in the ICU at 3 a.m. One hospital system mandated that all physicians wear their white coats at all times while on duty. Sounds professional, except white coats are notoriously difficult to sanitize between patients and are a known vector for hospital-acquired infections. And at 3 a.m. during a 36-hour shift, putting one on feels like a personal insult. But hey, appearances. Rule number 48. No food or drink at the nurse's station, including water. Because nothing says patient safety like making nurses work 12-hour shifts without being allowed to sip water. One charge nurse reported a colleague being written up for having a closed water bottle under the desk. The same hospital had a vending machine that only accepted exact change. Unionization happened shortly thereafter. Rule number 47. All patient calls must be answered with a scripted greeting. Thank you for calling hospital name, where your health is our priority. How may I direct your call today? Lovely, unless a patient is calling because they can't breathe. Nurses were told they had to finish the script before asking what was wrong. One nurse skipped it and was formally counseled. The patient was having a panic attack and needed immediate help. Rule number 46. Must use hospital-approved pens only. A regional hospital chain decided to brand everything, including pens. Staff were required to use only the official blue and gray pens issued by administration. Doctors who used their own pens were asked to rewrite orders. Someone once tried to rewrite a medication order using an unapproved pen. The medication was delayed by 45 minutes. Rule number 45. Social media policy. Don't post anything, ever, including your own lunch. Protecting patient privacy is crucial. Nobody disputes that. But this hospital's social media policy was so broadly written that nurses were told they couldn't post personal photos on their own private accounts during their off hours. One nurse was written up for posting a photo of her dog because she was wearing scrubs in the background. Rule number 44. Patient satisfaction scores determine your annual raise. Now, this one has real consequences. Hospitals began tying employee compensation to patient satisfaction surveys. The same surveys filled out by people on pain medication, people who are frightened and confused, and people who gave a 1-star review because parking was expensive. One ER nurse got a negative review because the patient was upset it rained. She lost part of her raise. Rule number 43. All IV lines must be replaced every 72 hours, even if functioning perfectly. Evidence-based medicine says change IVs when clinically indicated. Hospital policy said change them every 72 hours, no matter what. So nurses spent time waking patients in the middle of the night to restart perfectly working IV lines. Patients cried, nurses hated it. Studies later showed no infection benefit. The policy lasted 8 more years. Rule number 42. No sitting at the bedside without permission from a charge nurse. Therapeutic presence. sitting at a patient's bedside, is a recognized and compassionate nursing practice. One hospital decided nurses needed supervisor approval to sit down in a patient's room. The rationale? It looked unprofessional. The result? Nurses stood awkwardly while holding dying patients' hands. Rule number 41. All incident reports must be handwritten, in black ink, in triplicate. In the year of our Lord 2019, the hospital was still running a paper-based incident reporting system that required black ink, triplicate forms, and could only be submitted Monday through Friday during business hours. A weekend incident involving a medication error sat unprocessed for 2 days because it was a Saturday. Rules 40 through 31. The plot thickens. Rule number 40. Nurses cannot administer Tylenol without a doctor's order. A patient comes in with a headache. They ask for Tylenol. The nurse has to page a doctor, who is likely in the middle of something critical, to get a written order for over-the-counter acetaminophen. The patient waits 2 hours. The doctor is annoyed. Everyone loses. Rule number 39. The emergency room must always have exactly 12 chairs in the waiting area. Not 11, not 13, 12. A facilities manager apparently decided this, and it became policy. During a mass casualty event from a nearby car accident, staff were told to remove the extra chairs they brought in to seat the overflow of patients, because 12. Rule number 38. Doctors must use hospital email, not their phones, to communicate. In an age where seconds matter, one hospital system banned the use of personal phones for clinical communication between staff, and mandated that all communication go through an outdated internal email system with a 20-minute server refresh rate. Critical lab results were delayed. No one in IT understood why this was a problem. Rule number 37. Latex gloves only, even for staff with latex allergies. Yes, this happened. A hospital purchased an enormous bulk supply of latex gloves and refused to switch to nitrile because of the contract. Nurses with documented latex allergies were told to wear cotton liners underneath. One developed contact dermatitis serious enough to require medical leave. The supply contract ran for another 14 months. Rule number 36. All patients' rooms must have fresh flowers, except when they shouldn't. One hospital went through a phase of placing fresh flower arrangements in patient rooms as a hospitality initiative. Beautiful, right? Except oncology patients are immunocompromised. Flowers carry mold and bacteria. Nurses knew this. The flowers went in anyway because it tested well in focus groups. Oncology nurses removed them secretly for months. Rule number 35. The cafeteria closes at 2 p.m. on weekends. Hospital staff work 24 hours a day, 7 days a week. The hospital cafeteria, the only food option in a facility located 15 minutes from the nearest restaurant, closed at 2 p.m. on Saturdays and Sundays. Night shift nurses work at 7 p.m. to 7 a.m. had access to one vending machine selling chips and a sad granola bar. Rule number 34. You must call the patient by their full legal name every single time. Patient identification is generally important, but this policy mandated full legal name every single interaction, every single time a nurse entered the room. Good morning, Jonathan Alexander Pemberton III. I'm here to take your blood pressure. Jonathan Alexander Pemberton III. Jonathan asked the nurse to just call him John. She was told she could not. Rule number 33. Night shift staff must complete all daytime training modules during their shift. A hospital rolled out mandatory training modules, 8 hours of videos and quizzes on topics like fire safety and hand hygiene, and required all staff to complete them by a certain deadline. Night shift was given no accommodation. Nurses were doing online training between patients at 3 a.m. and getting written up for incomplete modules at 7 a.m. Rule number 32. All clocks must display military time, including in patient rooms. Fine in theory. In practice, no one told the patients. Elderly patients repeatedly asked nurse why the clock read 1400. Family members clawed the desk confused. One patient's family missed a procedure window because they thought 1400 meant 2 a.m. The clock stayed. Rule number 31. Nurses must knock before entering every room, even during code blue. Patient dignity matters. Absolutely. But this policy was written so broadly that nurses were technically required to knock before entering during any situation. During a documented code blue, cardiac arrest, patient unresponsive, a charge nurse paused to knock. She later said she didn't even realize she'd done it. The policy had become muscle memory. Rules 30 through 21. We're deep in it now. Rule number 30. Doctors cannot write orders from home, even via telemedicine portal. During a snowstorm that paralyzed the region, a hospital required that all physician orders be entered on site. A physician who lived 40 miles away and couldn't safely drive in tried to access the hospital's own telemedicine system to enter orders remotely. IT blocked his access. Patient care was delayed for 6 hours. He drove in anyway. Rule number 29. All patients must be given a welcome packet, including unconscious ones. Hospital administration wanted every patient to receive a printed welcome packet within 1 hour of admission. One nurse reported handing a welcome packet to a patient who was intubated and sedated in the ICU. She placed it on the bedside table. The patient would not wake up for 4 days. The packet stayed there the whole time. Rule number 28. No abbreviations in patient charts. Enforced inconsistently. Many abbreviations are genuinely dangerous. QD versus QID can be a fatal mistake, but this hospital banned all abbreviations, including perfectly safe and universal ones. Nurses spent extra time writing blood pressure instead of BP, while across the hall a physician was still writing SOB for shortness of breath because no one had told him about the policy. Rule number 27. Lunch breaks are 30 minutes, but must be approved 24 hours in advance. On a floor where patient conditions change by the minute, nursing staff were told that they needed to submit a break schedule the day before. If the patient says it's changed, as it always changed, the break schedule was invalid, but resubmission took time, so nurses just skipped breaks. This was considered acceptable. Rule number 26. All staff must smile while passing patients in the hallway. A hospital system rolled out a service excellence initiative that included a mandatory smiling policy in public areas. Staff were observed by administrators and then coached if they weren't smiling. Nurses leaving a room where a patient had just died were expected to smile at whomever was in the hallway. Several nurses reported the policy as genuinely traumatizing. Rule number 25. Patient discharge cannot be processed after 4 p.m. Discharge planning is complex, we get it. But this cutoff meant that patients who were medically cleared and ready to go home at 4:30 stayed overnight, occupying a bed, incurring additional charges, and delaying admission of the next patient waiting in the ER. This policy lasted 3 years before anyone ran the numbers on what it was costing. Rule number 24. Nursing notes must be exactly on 1 page. No more, no less. Documentation requirements vary wildly by patient complexity. This hospital standardized notes to 1 page. Number 23. No music allowed in operating rooms. Research consistently shows that appropriate music can reduce surgeon stress, improve team communication, and actually lower complication rates in certain procedures. Many surgical teams have playlists they've used for years. This hospital's administration banned all music in ORs because a patient once complained, despite being under general anesthesia during the operation. Rule number 22. Staff must use the designated parking lot, located half a mile away. Patient parking was valet. Visitor parking was attached to the building. Staff parking, including physicians arriving for emergency situations, was a half-mile shuttle ride away. In bad weather, the shuttle ran every 20 minutes. A surgeon reported arriving 11 minutes late for an emergency case because of this. The policy remained for 6 years. Rule number 21. Holiday decorations must be submitted for approval in October. In a hospital where people are dealing with serious illness, staff were told they could decorate their units for the holidays, but only after submitting decoration proposals to a committee for review in October. November decorations required a separate submission. A nurse who put up a small paper snowflake in December without approval received a formal warning. Rules 20 through 11. The home stretch. Rule number 20. All medications must be verified by 2 nurses, even saline flushes. 2-nurse verification for high alert medications is a critical safety practice. But when this verification requirement was applied to every single medication, Including simple saline flushes used to clear IV lines, it consumed enormous amounts of nursing time on clinically meaningless checks. Meanwhile, the actually dangerous meds sometimes waited for a second nurse who was busy elsewhere. Rule number 19. Nurses must clock out exactly on time, but cannot leave until report is given. At 7 a.m., night shift is required to clock out. Report. The verbal handoff of patient status to incoming day shift can take 15 to 45 minutes. Nurses were clocking out and then continuing to work unpaid, or rushing through reports and leaving their colleagues without critical information. Administration's position? Manage your time better. Rule number 18. Emergency medications must be locked in a cabinet that requires IT to unlock. True story from a rural hospital. The automated dispensing cabinet for emergency medications, epinephrine, atropine, the works, experienced a software glitch and locked itself. IT support was located off-site. During the 47 minutes it took to get the system overwritten, staff had to call a pharmacist on call who drove in from home with a physical key. The software was not replaced. Rule number 17. Patients' rooms cannot exceed a certain decibel level. Ever. Noise reduction in hospitals is a legitimate evidence-based goal, but this hospital installed decibel meters in hallways and set alarms if noise levels exceeded a threshold. The threshold was triggered during normal, necessary communication. During a code, alarms would go off because of the noise of the code itself. Staff learned to ignore the noise alarms entirely, which rather defeated the purpose. Rule number 16. Nurses must document every 15 minutes on all patients. All patients. 15-minute documentation for patients on suicide watch or in restraints, absolutely appropriate. 15-minute documentation for every single patient on a 30-bed medical floor, including the 68-year-old who came in for a routine knee replacement and is sleeping peacefully. That's 120 documentation entries per hour across the floor. No additional staff were provided. Rule number 15. Doctors cannot drink coffee in clinical areas, including their own offices. A hospital decided that all food and drink had to be confined to a break room on the second floor. Physician offices were clinical areas. Doctors who had worked 28-hour shifts were told they could not drink coffee at their desks. Several senior physicians responded by simply going home and sending orders remotely, which was technically also against policy. Rule number 14. All patient complaints must be resolved within 24 hours, in writing. Patient relations are important, but this policy required that every complaint, including the TV remote is sticky and I don't like the color of the walls, receive a formal written response within 24 hours, co-signed by a manager. Nurses spent hours on paperwork for complaints that had nothing to do with clinical care. The sticky TV remote took 3 written memos to resolve. Rule number 13. New hires cannot work independently for 90 days, but can be left alone after day 3. A hospital's policy stated that new nursing hires were in an orientation period for 90 days and couldn't work autonomously. In practice, staffing shortages meant new nurses were often alone with patients by day 3. The 90-day policy remained on paper, creating a legal fiction that was simultaneously protecting no one and complicating any attempt to formally evaluate new staff performance. Rule number 12. All patient teaching must be documented using the teachback method, whether or not the patient speaks English. Teachback is a legitimate and effective patient education strategy. This hospital mandated it for every patient interaction involving education. The method requires the patient to repeat information back. When nurses worked with patients who spoke no English and no interpreter was available, which happened regularly, they were still required to document that teachback had been completed. Rule number 11. MRI scheduling can only be done on Tuesdays and Thursdays. The MRI machine ran 7 days a week. The scheduling staff worked Monday through Friday. Rather than hire additional scheduling staff or create a weekend protocol, one hospital simply restricted non-emergency MRI scheduling to 2 days a week. Patients who needed imaging on Wednesday were scheduled for the following Thursday. Physicians started calling it the calendar rule. Rules 10 through 1. The Hall of Shame. Rule number 10. Pharmacy must approve all medications before administration, with a 4-hour turnaround. Pharmacist review of medications is a critical safety checkpoint that is usually a great idea. This hospital's pharmacy was understaffed and required a 4-hour turnaround on all new medication approvals. A patient in moderate pain waited 4 hours for their first dose of an approved standard medication because the system couldn't accommodate the clinical reality of the floor. Rule number 9. Nurses may not override the medication dispensing cabinet without 2 supervisors present. Cabinet overrides exist for emergencies. This hospital added a 2-supervisor requirement to overrides, effectively making emergency medication access take as long as the non-emergency process. During a documented sepsis case, a nurse needed an antibiotic that wasn't yet in the system. She waited 22 minutes for 2 supervisors to arrive. The patient survived. The policy did not change. Rule number 8. Staff cannot discuss patient prognosis with family without a formal family meeting request. Family-centered care involves open, honest communication. This policy required that any discussion of prognosis, including conversations initiated by family members in the hallway, had to be deferred until a formal family meeting was requested, scheduled, and attended by a physician, social worker, and a charge nurse. A wife asked a nurse if her husband was going to be okay. The nurse had to say she couldn't discuss it. Rule number 7. All patients' restraints require a doctor's order, but doctors cannot be called after 11 p.m. for non-emergencies. If a patient at midnight begins trying to pull out their ventilator tube, a life-threatening situation, nurses technically need a physician's order for restraints. But calling physicians after 11 p.m. for non-emergencies was against policy. Pulling out a vent tube is an emergency. But the physician on call had told staff they didn't consider restraint orders emergencies. Nurses improvised. It was not safe. Rule number 6. All equipment must be returned to the central supply room after each use. This sounds fine until you realize the central supply room was 2 floors and 3 elevator rides away, and the equipment would be needed again in an hour. Nurses were routinely returning and rechecking out the same equipment multiple times per shift. One nurse calculated she walked an extra 4 miles per shift just returning equipment. Her Fitbit numbers were excellent. Rule number 5. Doctors must get committee approval before ordering certain medications, including for patients already on them at home. One hospital created a restriction medication committee that required multidisciplinary approval for a list of medications deemed high risk. The list included medications that many patients took daily at home. A patient admitted for surgery who had been on a medication for years couldn't receive it until the committee convened, which met once a week. The patient went without for 6 days. Rule number 4. All codes must be called using a 10-code system that nobody had memorized. Code blue meant cardiac arrest. Code red means fire. Most hospitals use plain language or simpler code colors. This hospital switched to a numerical 10-code system, like police radio, without adequate training. During a real fire, a nurse called a 1072, which nobody recognized. Several staff ran to the wrong location. The hospital reverted to plain language within 48 hours. The policy had been in place for 3 months. Rule number 3. Hospital administration gets private parking, private dining, and priority elevator access. This one isn't funny, it's just revealing. At a hospital dealing with chronic nurse turnover and staff burnout, senior administrators had reserved parking spots at the door, a private dining room with catered food, and keycard access to an elevator that bypassed the crowded main lifts. Nurses walked half a mile and ate from vending machines. Morale was, reportedly, not great. Rule number 2. Staff are prohibited from discussing understaffing with patients or media. Hospitals routinely have staff sign broad non-disclosure agreements and gag policies that prevent them from discussing internal operational issues, including staffing levels, with patients, family members, or the press. Nurses caring for 7 patients when the safe ratio is 4 were unable to tell family members why their loved one's call bell had gone unanswered for 40 minutes. This policy exists at hospitals across the country right now. Rule number 1. The dumbest rule of all. Prioritizing the appearance of quality over quality itself. And here we are. Number 1. The rule that underlines all the other rules. Across every hospital, in every department, the single most consistent, most damaging, and most durable rule is this. When in doubt, project the optics. Make it look like quality care is happening. Score well on all the surveys. Keep the Joint Commission happy. Train staff to perform compliance theater. Real quality, the kind that saves lives, retains talented nurses, and builds institutional excellence, requires admitting what isn't working. It requires feedback from the people doing the work. It requires the courage to change a policy that sounds good on paper but makes no sense on the floor. The dumbest rule in any hospital is the unwritten one that says the people at the top always know better than the people at the bedside. They don't. They never have. And there you have it. 50 of the dumbest hospital rules real doctors and nurses have had to follow. If you work in healthcare, you probably recognized at least a few of these. If you've ever been a patient, you may have experienced the downstream effects without even realizing it. The good news, many hospitals are actively working to reform their cultures, involve frontline staff in policy decisions, and prioritize what actually matters. There's a movement in nursing and medicine towards evidence-based staffing, shared governance, and real accountability. The bad news is bureaucracy is stubborn, and until patient safety is consistently elevated above paperwork and optics, we'll keep collecting material for videos just like this one. If you enjoyed this video, please like, subscribe, and hit that notification bell. It genuinely helps the channel. Drop a comment below with the dumbest workplace rule you've ever had to follow, healthcare or otherwise. We'd love to hear from you. And as always, thank you every doctor, nurse, tech, and healthcare worker out there doing an incredibly hard job, often in spite of the rules. You're the reason the system works at all. See you next time.